My name is Scott Rawson, R-A-W-S-O-N. I'm the Executive Director at Center LifeLink EMS, and I've been here since December 1st of 1997.
Can you tell us a little bit about Center LifeLink?
Sure. Center LifeLink is the community ambulance service for State College and Ferguson, Patton, Harris, and College Townships. And we've been the ambulance service back as far as 1941. And we've grown from one ambulance and 3 ambulance attendants to we currently have 7 ambulances and 4 non-emergency transport vans. Our call volume really took a hit in 2020 due to COVID. Because when you lose 40,000 students out of the community, it has a major effect on our call volume. So we dropped from about 6,400 calls in 2019 down to 5,400 in 2020. And the other thing that shifted is where our calls were located. Because our calls, a lot of them, especially on weekends, would be downtown State College.
Yeah.
And when the students aren't there, we don't get those calls. But what we found is that early on during the COVID pandemic, people were staying home. And even when they were sick and needed to be transported to the hospital, or should have been, they weren't going. So when we would get the call, oftentimes patients were much sicker than what they should have been at that time. But our location of calls changed to the townships where there's some long-term care facilities, some nursing homes, things like that, where when you get COVID in a facility, well then that spread, and so that facility was considered to be 100% COVID. So our crews were donning all of the appropriate PPE for any call in that facility. So the calls took longer because the crews had to put on the personal protective equipment, but also they had to disinfect the ambulance after completion of the call. So that's been a challenge for Center LifeLink, but we've made it through so far. And but when you lose 1,000 calls off of your call volume, and our finances, our revenue is generated by the fee for service for the ambulance calls, and then the membership campaign and the community support that we have. And I've got to say that the community in the Center region has really stepped up and done very well for us. So we're so appreciative of everything that the community has done. And we're just wrapping up the 2021 membership drive, and we're exceeding the goals. This is our highest year ever for memberships. So not only the memberships, the number of memberships, but the donations that come in with the memberships. Center LifeLink also is one of 5 ambulance services in the Commonwealth of Pennsylvania that are accredited by the Commission on Accreditation of Ambulance Services. And we were first accredited in 1999, so then every 3 years thereafter we go through a reaccreditation. The reaccreditation we were due for reaccreditation in July of 2020, but due to COVID, they shut down the reviews for a while, and actually we had our reaccreditation review in February of 2021. And we were able to become reaccredited, and that's meeting a total of 308 standards there are, with no deficiencies in February of 2021. So we're one of 5 in Pennsylvania and one of 192 services nationally that, as CAS, or the Commission on Accreditation of Ambulance Services, says is meeting the gold standard for the ambulance transportation industry.
That is fantastic.
Yeah,
So you and your staff work really hard and continue to work, it sounds like, even harder during the pandemic to meet these standards and ensure that those who were in need of emergency medical treatment were receiving that, which put, it sounds like, even more pressure on your staff to make sure that the facilities receive some additional cleaning and sanitization.
Yeah, our crews really stepped up. We lost a lot of staffing because we have about 40 staff members, paid career staff members, and then our volunteers. Many of the part-time employees and the volunteers are Penn State students, and when the pandemic hit, they went home, so they were no longer able to volunteer for us. So our full-time and the part-timers that remained in the area and just a few volunteers really stepped up to cover, to make sure that we had the ambulances in service. And one thing that we found is that we couldn't decrease the staffing. Even though the call volume dipped, what we found was that over 190 times in 2020, we had 3 or more simultaneous ambulance calls. So we couldn't cut back on one of the 3 ambulances that we staffed during the day, or one of the 2, the minimum of 2 that we have overnight, because when you get 3 calls at the same time, you've got to have the crews to respond. So, and by maintaining the staffing, we were able to cover 98% of the calls that we were dispatched to in 2020. If a neighboring community can't get their ambulance out because of multiple calls or not having the staffing, then through the 911 center, we're dispatched through a mutual aid agreement. So, sometimes we would have all 3 ambulances gone to other communities.
Is that typical outside of the pandemic, or?
It is. There are some communities where the ambulance service is struggling due to financial reasons, due to staffing reasons. It's just it's a difficult time for emergency medical services right now.
Can you also shed some light on some of the other services that you provide through Center LifeLink in addition to the ambulance service?
Sure. We provide a lot of training, and it's usually EMS related training, like CPR training. We offer a lot of that, and we had shut down the training center during the pandemic, but we're doing that again. So we have community classes. We do a majority of them here, but we will go off-site to a business that wants to have their personnel certified in CPR. So we're getting that up and running. The classes that we do in-house are still limited by number, so that we can do the social distancing in the training room. We also have a Phlebotomy Institute of Central Pennsylvania training program, and what that does is it's a 6-week program that certifies persons in how to draw blood, to be a phlebotomist, and many of them go on to work at hospitals or doctors' offices or wherever. That's a program through the Pennsylvania Department of Education. But the last 3 programs have been canceled. We were doing 2 a year. The last 3 have been canceled because as part of the program, they're required to do an internship, and the hospital was not permitting individuals to come in to do their training, their internship. So hopefully we can get that going again. We have a tactical emergency medical services team that works with the local law enforcement agencies. And if you've got a hostage situation, or just a call where the local law enforcement officers want to have some backup. We have the Thames medics, and our medical director, Dr. Neal, is very involved with that as well. We have a search and rescue team. CREST is what that is, and they get called out when a person wanders off, gets lost, or is missing for whatever reason. So that's another service that we provide here. I would like to say that the residents in the center region are very fortunate in that part of the emergency medical services team is the law enforcement, and we have a response where the local law enforcement officers are dispatched or notified by the 911 center every time there's a medical emergency in the community. And that has proven to be life-saving many, many times, because the law enforcement officers are out in their car, they're mobile in their municipality. So Ferguson Township, for example, if there's a call out in Pine Grove Mills, they're usually much closer and can arrive on the scene well in advance of the ambulance responding. They're able to assess the situation. They're able to start CPR. They can defibrillate if needed. So it's proven life-saving. And we work with the Ferguson Township, the Patton Township, and the State College Borough Police. And I am one of the on-site reviewers for the Commission on Accreditation of Ambulance Services. So I've been doing that for 20 years. And a lot of the services have a dual response, but it's with the fire department. We don't have that here. We have Alpha Fire Company and Bollesburg Fire Company that will go out to motor vehicle accidents. Alpha Fire Company will go out if we request them to assist in removing a patient from a building, if it's something unique, but they don't go on every call. Where with the local law enforcement, it's just such a benefit in our communities to have their response. We have a program where if we have an individual who may be interested in pursuing a career in the health-related fields, that they can come in and, a couple times and do a ride-along in an observe-only manner, but they ride along and get to actually see firsthand what the emergency medical services is all about, from being at the station prior to a call, to responding to the call, whether it's emergency or non-emergency, be able to see the assessment being done by the EMT or paramedic and any care provided, and then the transportation to the hospital. And they can also see the interaction between the EMS crew and the hospital personnel after that. So I think that it's sometimes eye-opening for the individual to see what happens pre-hospital, but it's something I think is very beneficial.
Absolutely. It certainly was a meaningful experience for Madeline. Thank you.
Oh, sure.
Scott, I did want to ask you, were you a volunteer EMT prior to taking your role here with Center LifeLink, or have you served in a similar capacity?
Yeah, actually I started out as a volunteer, and I started out with in my hometown, which is in Potter County in Galton, is where I grew up. And actually, due to the TV show Emergency, which had paramedics from Los Angeles County, I would watch that show, and I actually watched that with my parents, and decided that emergency medical services is what I wanted to do. My dad was the fire chief at that time, and at 16 I joined the rescue squad and responded to a lot of calls. But then I joined the Gale Hose Ambulance Company in Galton, Pennsylvania, and Gosh, when I was growing up, for 3 consecutive years, I was the volunteer ambulance driver of the year for the service, and actually the plaques are those three
Yeah.
across the top there. What I would do is, when I was not working, after high school, any off time that I had, I was available for the fire department or the ambulance service, and decided that I wanted to make that a career. And I applied to paramedic school. In the first year, I wasn't accepted. And then I applied the second year, wasn't accepted. So I decided, well, okay, I got to do something. So I enrolled at Williamsport Area Community College and started going there. And then they said they had an opening in the paramedic program. So after one semester at Williamsport Area Community College, I went to the Williamsport Hospital and Medical Center paramedic training program. And we started with 33 in the class. We graduated 19, and I was ranked number 3 in the class of 19. So it was just something that it's what I wanted to do. And I don't know whether it was I didn't interview well or what exactly it was, but when I got in, that's what I wanted to do, and that's when I started as a paramedic. And I worked for 15 years at Soldiers and Sailors Memorial Hospital in Wellsboro, Pennsylvania, as a paramedic, both volunteer and then as a paid paramedic, and then the training coordinator. And then in 1997, we moved to State College, and I became the executive director at Alpha Community Ambulance Service, which is now Center LifeLink EMS as of January of 2004.
Oh, incredible story, and so accomplished, working your way right through all of the levels and ranks to be as accomplished. And I know I'm thankful for your leadership here. You certainly have expanded the services and provided a meaningful impact here in the State College community. Thank you.
Well, thank you very much. Yeah, and we do have here at Center LifeLink, we have just a great community-based board of directors.
You have a very great board. I can tell that they're, I'm sure, hands-on and provide some valuable insight as well.
Yeah.
So you're very fortunate to come with the experience you have, your board, and your staff. I mean, it certainly shows through the type of services that are provided here in the State College community that everyone here is really engaged and they're in it for all the right reasons, and the collaboration is very fruitful for all involved. And then I also am curious if you wouldn't mind sharing, what are the rewarding aspects of EMS work from your position and perspective based on a lifelong career that you've had?
I think the rewarding aspects are when our crews make a difference. It doesn't, and obviously when you save someone in a cardiac arrest, yes, that's very rewarding. But it goes more than that. I just received an email this morning that I had the unfortunate need to call an ambulance for my mother. This is a note of thanks to the young lady and young man who arrived and transported her to the emergency room. In a later discussion with the ER doctor, he stated that your team had correctly diagnosed my mother as having a stroke and had communicated that information to the ER, so the ER personnel were ready to treat my mom on arrival.
That is
so that
fabulous.
Something like that I think is very rewarding, and we share that with the staff. And our staff goes through frequent evaluations and scenarios with our medical director. Dr. Cliff Neal is our medical director, and he comes in on a weekly basis and does a ride along with our staff. So to have the medical expertise of our medical director and have our staff be comfortable in reviewing calls with him and stuff is very helpful.
Thank you for taking time to hear about the Center LifeLink services that are provided in the Center region. Ferguson Township Board of Supervisors adopted a proclamation to honor emergency services by honoring them all of this week. Check back at Ferguson Township website and social media sites to hear more about the wonderful emergency medical services provided within Ferguson Township and in our Center region.